This is a informational session about the Master of Healthcare Innovation degree from the University of Pennsylvania. It's an online degree here. And just a few housekeeping things before we get started with the actual presentation. There will be dedicated time for Q&A at the end of the presentation, but if you have any questions as we're going along, please feel free to type those in the chat box that's on the right side of your screen in blue jeans, and a moderator will see it and will ask the question aloud for you. I've also put up my email in the chat box in case you want to contact me with any questions after the session. My name is Catherine Rodella. I'm the program manager for the Master of Healthcare Innovation, so I work more on the administrative side and do a lot of student support. I am a point of contact not only for current students, but also for applicants and prospective students. So if you have questions about applying and about the program before you join, I'm the person that you can contact. So today we're going to look at an overview of the way that the degree is structured. We'll look at the curriculum and how the schedule works throughout the course of the degree. We will also talk about tuition, go over how the on-campus portion of the degree works, and we will talk a bit about learning online since it is a little bit different than what some people are used to in a degree program. Also on the call with me is Adam Zolkover, our Associate Director for Online Instructional Design, who works on the course delivery side of things and works very closely with faculty to transfer their expertise into effective online classes. So he'll actually get to show you a brief tour of one of our online courses. We'll get to hear from a couple of current students who are on the call about their experience in the program. And finally, I'll go over a couple of certificate options that we have as well, how the admissions process works. And again, at the end, we'll have time for dedicated Q&A. But just to repeat what I said earlier, if you have questions throughout the presentation, please feel free to go ahead and ask them. You can type them in the chat box. So the Master of Healthcare Innovation is an online degree program from the University of Pennsylvania. Specifically, we're housed in the Perelman School of Medicine in the Department of Medical Ethics and Health Policy. The overall mission of the program is to address the rapidly changing healthcare landscape by advancing innovation among healthcare professionals. And the degree does that by focusing on four main areas in the curriculum. Those are health policy, behavioral economics, operations management, and innovation methodologies. So it is a fairly interdisciplinary degree, and that's reflected in our faculty members. They come from the Perelman School of Medicine, from the Wharton Business School, the Penn Law School, and from the Penn Medicine Center for Healthcare Innovation. This degree is designed for mid-career healthcare professionals who apply practical tools and skills not only to their current workplace, but possibly also their future workplaces as well. And overall, the ultimate goal of the program is to improve the way that healthcare is delivered. So students will do a few things throughout the course of the program. First, they will build a network. This is a cohort-based program, so students go through the degree with a cohort together, and those fellow students really become their resource network. They work with each other and learn a lot from each other. Students are professionals with all sorts of different backgrounds related to healthcare, so they really learn a lot from this mixing together of perspectives and experiences. Second, students develop practical skills for designing solutions to problems in healthcare. Again, it's meant to help professionals improve the way they do their job now and how they would approach future roles as well. And finally, students get a chance to apply concepts from courses in practice-based innovation labs so that at the end of the degree, they'll be able to implement an innovation project in the real world. So who are our students? We're a fairly new program. The first cohort started studying in fall 2017 and will graduate this year. And the second cohort just started in fall 2018. So currently we have 33 students in the program with many different healthcare-related backgrounds. They have, on average, about 14 years of experience in the workforce, and that ranges from around 4 to over 30 years. They come from all over the US, and this year we have our first international student from Japan. Overall, our students come from many different healthcare-related backgrounds professionally, both clinical and non-clinical. So there's a few examples up here on the slide, and this certainly is not an exhaustive list of the kinds of roles and backgrounds that a potential student could have. A couple off the top of my head that have not been represented in the program yet are somebody from medical device companies, government agencies, and dental medicine as well. We also do welcome applicants whose professional experience might not be directly in healthcare, but in a related sector. And those applicants will just have to clearly demonstrate in their application how their experience could translate into an impactful career in healthcare. There are a few main reasons why students choose to do this program. Some students want to improve the way that they do their work in their current role. Some students are recently taken on or about to take on a new role, and they want to learn those skills and fill knowledge gaps to be successful in that role. And finally, a lot of our students aspire to a more leadership role in the future. So this is a bird's eye view of the entire 20-month curriculum. This is, of course, the schedule for the current class of students that just started this fall. So anybody who's applying right now and gets accepted would start in August 2019 and then would graduate in spring of 2021. Two important things to note about these classes. All of the classes are all online, and they don't follow typical semester-long schedules. So, for example, if you look at these blue courses that are listed, those are the core courses. They're only 6 weeks long, but content and work-wise, they are still equivalent to a typical semester-long course. So they're fairly intensive and rigorous and move at a fast pace, but there is time built in for breaks. There's usually 1 week off in between courses to pause, with longer breaks over the holidays and the summer. The very first thing that students do when they join the program is they come to campus for 5 days in August for the on-campus session. The next one, which you see in the upper right side of the screen, is scheduled for August 17 through 21st. And there's a lot that goes on. It's a pretty jam-packed week. There's a lot of educational programming. We have presentations by faculty members and outside speakers, skills workshops, orientation sessions for new students. And the main goal really of the on-campus seminar is for the students to get to know each other and the faculty and to start making those connections and pave the way for collaborations later. After the on-campus seminar, students go back to wherever they all live, and for the rest of the school year, all of their coursework is online. So in addition to those core courses that I pointed out, and the core courses cover the main focus areas of the program that I mentioned earlier, 4 of those core courses have a lab course affiliated with them. And in the lab course is where students get a chance to do a deeper dive into the topic and really apply the concepts that they learned in the core course. Lab courses are 4 weeks long and typically take the format of some sort of mini project or 4-week assignment where they apply the concept. So for example, in the behavioral economics lab, students would get a case to analyze and then need to write a proposal for a behavioral economics intervention. And the last type of course are the electives. So whereas with the core courses and labs, a cohort is all taking those together at the same time, in the 2 electives, students do get a choice of courses to choose from to match their own interests and roles. And I do want to mention that, so this is what a typical degree structure would look like, the typical 20-month track. Starting this fall, we will also be offering an alternate extended track of the program where you could spread it out over 3 years. And that's for those who might need to spread out the workload and financial commitment over more time. In that track, you would still need to meet the same exact degree requirements. The overall cost would be the same, but it would just be spread out a little bit more. And if anybody is thinking of that track might be right for them, please contact me. I can talk to you a little bit about it more after the session.
Hi, Catherine. Would this be a good time to ask a couple of questions?
Sure, go ahead.
One person asks, are any students respiratory therapists?
Not at the moment, but I think that somebody with that sort of background could certainly make sense to apply.
Somebody else asks, how many applications do you usually receive for each cohort?
I don't have the number for exact applications off the top of my head, but acceptance-wise, we do keep the cohorts fairly small by design, and that's to keep the program pretty high touch, especially since it's an online program. Okay, so a bit more about those lab courses that I mentioned. These are what the 4 lab courses cover. In the first 2 lab courses, behavioral economics and operations management, that's where you're sort of learning the skills to get your ideas out into the world. As a mid-career professional, you've probably seen things in healthcare that you realize could be fixed or could be done better, and these will teach you to start having that voice to get your ideas out there. And then finally, in the last 2 labs of the program, which take place all the way at the end in the final spring semester, that's where students really are drawing on their work experience and they develop a project idea and prepare to implement it. So at the very end of the program, students have a fully formulated written innovation project proposal in hand that's ready to be implemented in the real world. Options for elective courses do vary from year to year, but to give you an example of the kinds of topics that you might see, these are the elective topics being offered this year for current students that have started this fall. Electives are structured a little bit differently than core courses in that each of them has 2 mini topics that are paired together, so 2 complementary topics. So for example, students would study the first topic in the first 3 weeks of the class and then would study the second topic in the next 3 weeks of the class. There is one on-campus elective option that students could choose to take, clinical mediation, which is an intensive 4-day course, a very interactive course taught on campus, and the rest of the elective options are online. Tuition at Penn is billed on a course unit basis. So course unit is the way that Penn counts academic course credits. To give you an example of what that means, so one course unit, a 1 course unit course, is equivalent to a typical semester-long course. So a lot of universities might call that a 3 or 4 credit course. Our core courses are 1 course unit, electives are 1 course unit, and labs are a half course unit. So throughout the duration of the degree, students will take 11 course units or CUs total. In the upcoming academic year, 1 course unit would cost $5,629, and that's for both the tuition and fees. So overall, it puts the total cost of the program somewhere in the ballpark of $62,000, taking into account that rates could change slightly from year to year. And that total does cover everything, tuition and fees. The on-campus session is included in that. There's no additional fee or charges for that session. There are no scholarships available directly from the program, so students pay for the degree in a few different ways. Some are self-funded, some students are able to get funding from their employers, and some students do choose to apply for federal education loans. The federal loans are only open to U.S. citizens only, but international students could look into private loans, but they might need a U.S. cosigner to do so. And if you are thinking that you might want to look into federal loans, just note that students need to take a minimum of 2 CUs in a semester in order to be eligible for loans in that semester. And the way the program is structured, especially in the 20-month typical track, in most semesters, students will be meeting that 2 CU requirement. But depending on the way you choose your electives, 1 CU might fall in one semester or another, so it's possible that there could be a semester in which a student would not be taking at least 2 CUs and would not be eligible for federal loans in that semester. Well, as I mentioned, the on-campus seminar is also included in tuition. There's no
Hold on,
additional
Catherine. We have
cost.
a
Oh,
question
sorry.
before we move on.
Sure, go ahead.
Are there funding resources available through Penn? For example, are there financial aid counselors or somebody who could guide us through scholarships and loans?
Yeah, there is a financial aid office at Penn, and they would help guide students through the federal financial aid process. So once you were applied and were accepted, we would put you in touch with that office who could guide you through it. Okay, well, students attend the on-campus seminar twice while they're in the program. It happens every August. It's always 5 days in late August, and the one for this year is scheduled for August 17 through 21st. And like I mentioned before, it's a pretty jam-packed week. We do interactive workshops. For example, there have been workshops on negotiation and on public speaking skills. A lot of opportunity for networking and socializing with not only with your fellow students, but also with faculty members and with outside experts that come in to give presentations. And of course, we do orientation sessions for new students. That includes technology orientation. So before everyone leaves the on-campus seminar, before they even start their online coursework, everyone knows how to access the online courses and navigate them. So students are responsible for their travel to and from Philadelphia, but the rest of the seminar costs are covered by the program. That includes lodging on campus for students who need it and meals and activities throughout the week. International students, I just want to mention, would have to get a B1 business visa in order to attend the seminar. Like I mentioned before, the courses are fairly intensive because they're on that shorter 6-week time span rather than on a semester length. So students do spend around 12 to 14 hours per week working on the courses, and that includes both what you might consider in-course time, like watching lecture videos, and outside class time, like working on assignments and homework. The content in the courses are split into 3 main types of content. First, your media, which will be things like brief engaging lecture videos and videos of faculty interviews with experts. There are often readings to provide context to the lectures. There are interactive components of the classes. Every week there's always a discussion thread to post to. Most weeks there is a live video session led by the faculty member that keeps everybody engaged from week to week, even though they're working remotely. And finally, of course, there are assessments. There are quizzes in the courses, assignments, and students do receive letter grades for the courses. And even though the courses are rigorous and intensive, they are built to be flexible. All of the students in the program are working full-time. They all have very demanding schedules and responsibilities outside of school. So we are used to working with students one-on-one to help them if they need help keeping up with the courses. There are deadlines for assignments, but all of the content and media is available on demand. It's designed for being accessed from a computer, but can also be accessed from a smartphone. And there's always a week off in between courses to pause. So with that, I want to turn it over to Adam, who will give us a quick tour through one of the online courses so you can see what one actually looks like.
Great, fantastic. So just briefly, I wanted to take you through 3 main parts of the course. The front page, the structure of the course, the modules outline, and then what a lecture page looks like. So the first part is the front page of the course, and what I have up here is the American healthcare system with Dr. Emanuel, and the reason that I have it up is that it's the first course that you would take as students in the program. And you can see here, right from the beginning, we have a clear statement of what the course is, and we have an overview of the course. I'm not sure that it's going to be large enough for you to read right now, but being able to read it isn't necessarily what's important at this point. We can send out some slides if that's something that you guys want. Scrolling down the page, one of the things that you can see is that there is a clear listing of topics and key dates. And the topics and key dates are important here because they help you plan your time. You'll get this before the course begins so that you can write it into your calendar and then you'll be able to use it. Finally, if you scroll down to the bottom of the front page, I want to show you one last piece, which is this big red Start Here button. When you press the Start Here button, which I'm in a mock doing, I'm not actually going to do it right now, where it will take you is to the course modules page, and the course modules page is really where the meat of the course is. You can see here that the course modules page starts with an introduction to Canvas and help with Canvas. There's always resources to help you. There are built-in resources to the course. You can contact your TAs, you can contact the staff. Anytime you need help, you're able to get it. Scrolling down, you can see what a week looks like in the course. There are items for you to watch. These are all lecture videos right here. There are items for you to read. There's only 2 in this case, but usually there's 3 to 4 items per week for reading. There is a synchronous session, which is one of the few things that has a real-time deadline where you'll meet live with faculty, with TAs, and with your colleagues to talk about the content of the course. There are some assignments. In this case, there's a discussion and a reply. And there's also a quiz. There's one thing that I want to say about assignments, which is that assignments happen on a predictable schedule. Usually in courses, they're due on Sundays and Tuesdays. So that should help you plan your time as well. The last thing that I wanted to show you was an overview, or rather a lecture page. This one is an overview of the Affordable Care Act, which is sort of the meat of Dr. Emanuel's course. In this case, what you can see is a title. You can see that you have access to how long a lecture is. So again, you're able to plan your time. For example, if you're on the bus and you're watching this on a smartphone, you can tell whether you're going to need to pause before your next video so that you can get off at the right stop. You can see here that this is what our videos look like. They are high production value. They include professional slides. They are made to facilitate your being able to take notes. You can view directly on the web, which means that you can get a full screen version, and you can also download a transcript of every single video. Finally, scrolling down, the last thing that I wanted to show you on this page is supplementary materials. Most of our lectures come with a variety of supplementary materials that include links out to the World Wide Web, links to scholarly resources, and also downloadable PDFs that will help you make the most of lectures and help you dive deeper if that's something that you want to do. So that's what I have on the way that these courses are structured in general. If you have any specific questions, please feel free to ask. Feel free to ask anything else in the chat box as well, and we will try to answer your questions. And with that, I'm going to hand it back to Catherine.
So learning online can be a bit different from what a lot of students are used to. A lot of our students either have never done an academic online course before. They might have had experience with, say, professional webinars they've had to do for work, but not for an academic credit course that counts toward a degree that's online. So it's really helpful to have the expectation before you come in that learning online might take a slightly different skill set than what you're used to. And we've compiled a few of these sort of best practices for learning online here to help you think about what that might entail. Again, like I said, understand expectations before you begin. At the beginning of a course, it's great to read through the syllabus and understand, okay, what assignments and requirements will there be, when will the deadlines be, and get those in your calendar so you can plan your schedule around them. Take notes as you watch lecture videos just the way that you would in an in-person class. You want to make sure you take frequent breaks so that you're pausing to really absorb the information. And one of the most important parts of learning online is to be proactive and really communicate. So if you feel you're falling behind, you want to make sure you talk to a TA right away who can help you stay on track. Really participate in the discussion forums and learn from your fellow students who have a lot of valuable experience. And finally, you want to be mindful of time management. Students spend around 12 to 14 hours a week, like we mentioned. And like Adam said, course assignments tend to fall on a predictable schedule, so you can kind of help plan your schedule and maybe your work around those. That being said, we do have a lot of support. You're not just out there without a life raft working on your own remotely. We do the technology orientation at the on-campus seminar before you will ever need to start one of your online courses. We maintain a community website with tips and tutorials and all sorts of great videos about how to navigate Canvas, which is the platform that the courses are on. There's coursework help from the TAs and from our course coordinator who answer very quickly to student questions. Administrative support from myself and from our other staff here. And finally, we have technical support from our own in-house help email. And there's also a Canvas help desk if you're running into technical problems with Canvas itself. So there are real humans here in this office who, our job is to help you and support you and answer your questions as you go through the program. And we do have 2 current students on the call who are nice enough to take time from their very busy schedules to be on the call today and talk a little bit about their experience in the program. Brian Kearns is one of our students who just started this fall, 2018. And Tim Lucas is one of our students from the very first cohort who will be graduating very soon this spring. So Brian and Tim, thank you so much for being on the call. First, can the 2 of you just sort of introduce yourself and what you do? Brian, do you want to start?
Sure, sounds good. My name is Brian Kearns. Can you hear me okay, Catherine?
Yep, I can hear you great.
So I work at a company called Globus Medical. It's a medical device company focused on spine. And I've been in healthcare and mostly healthcare finance for roughly 30 years. Brief background, started with J&J, worked in financial management there, then moved over to Wall Street, was a stock analyst in healthcare for a while, and then served at 2 different public companies as CFO, one a healthcare IT hospital service company and the other a generic pharmaceutical company. Did my own thing in strategic guidance and M&A advisory work, and for the last little bit more than 4 years have worked at Globus in the M&A and really the innovation process, and I'm also investor relations for them. That's my background.
Great, thanks. All right, Tim, can you introduce yourself and tell us a bit about yourself?
My pleasure. Is the microphone working?
Yep.
Yes.
Okay, great. So my name is Tim Lucas. I'm a neurosurgeon here at Penn. So my background is on the opposite end of the business spectrum, so I'm very, very academically focused. So I'm a clinician. I also am a PhD scientist. I run a neuroengineering lab. We have several NIH and NSF grants, as well as some Department of Defense grants. I'm very steeped in academia and very interested in the challenges that academic physicians face. So most of my project was really geared towards addressing problems in academia across the country. So happy to address any of those who have that particular interest throughout this call.
Thanks. All right, so with 2 very different backgrounds, can you tell us, this question is for both of you, why you decided to pursue the MHCI? And Brian, again, can you start off?
Sure, I'd be happy to. So it was interesting that I was actually looking for a master's program for my daughter to participate in at the very same time that I was doing a bunch of research on corporate venture capital and healthcare innovations, because one of my goals at Globus is to start up a corporate venture capital company with a fund dedicated to investing in innovative companies. And the combination of those Google searches yielded the UPenn program on healthcare innovation, and it popped up. And I was just curious, so I looked at it, and I looked at all of the different course offerings, and it wound up aligning very closely with some things that I'm very interested in personally, that I've spent some time reading and researching just in my own free time because I have an interest there, which included behavioral economics and just economics in general and a few other things. And the more I read into it, the more I was like, wow, that would be great. That professor looks very interesting. And it just built on itself. And then I wound up thinking to myself, I always wanted to be the type of person that would always keep the saw sharp and challenge myself and continuous learning and all of those things. And I said, well, if I really want to be that type of person, why don't I be? And that's how I made the leap in. And I'm very glad I did.
Great, thanks. All right, Tim, why did you decide to pursue this degree?
So I was motivated by wanting to enact a strategic vision for large health systems. largely academic health systems, and was spending a lot of time looking at executive MBA programs, including the one here at Penn, but there's a number of other excellent programs as well. And I was disenfranchised by the list of courses. MBA programs are wonderful, but the mindset and the skills that one acquires during an MBA are not directly applicable to a health environment. Certainly you can augment an MBA with a few specific courses that are related to physicians' workplace, but this program was very specific in the health space and has a lot to do with enacting health policy, development of health policy, and health law. That was all fundamental, not peripheral to me, so this program spoke precisely to my long-term interests.
Great, thanks a lot. A question for Brian. So you have a demanding work schedule and personal responsibilities. How do you balance time spent doing your coursework on top of all of that?
I guess I can start by saying it's not easy, but
Right.
it has been very worth it, and it's has been very rewarding for me. But I think it's probably not inappropriate to say, like many areas of life, you get out of this program what you put into it. You probably could get through and consider it a success if you wanted to view it that way without putting a tremendous amount of time in. I've been averaging a little bit less than that 12 to 14. I think I've been in the 10 to 12 range hours per week. And the way I try to do it is as soon as the prior week's work is done, I try to get a head start. Sometimes I'm successful, sometimes I'm not. But a couple hours during the weeknights, more often than not, I spend a good deal of my Saturday on this, and then part of Sunday, and then wrap things up, and then try to start things over again. But what I found easier than I expected was the natural motivation coming from the learning. If I wasn't getting something out of it, it would probably be a little bit more of a task that I was trying to manage. In this case, the courses I've had so far have been something I'm excited to take on and to learn because I'm really getting so much out of it.
Thanks. Yeah, definitely agree about getting out of it what you put into it. Question for Tim. Now that you're just about done with the degree and graduation's on the horizon, can you tell us a bit about the cohort experience, and have you built a network through the program?
Yes, so we were the first class, so I think we were paving new ground in some respects. The cohort was excellent. We had a wide range of individuals that had different degrees of experience and came from different walks of life. So it was very helpful for me to see our program through their eyes. I have certainly developed many strong friendships with those individuals, and I keep up outside of the coursework with a good number of the cohort. In fact, some of us have talked about creating a little business side venture because we have very similar interests. The cohort class that started just after us, I'm getting to know more and more, and I think there's many fascinating individuals in that group. But there's more than just the cohort that you network through. Certainly the course faculty. I've developed good relationships with many of them, and I think some of the papers that are coming out of the work that we're developing now will include some of those faculty. I feel like we will have a durable relationship that'll extend well beyond the course, and also the people who are mentors on my project. I developed a project that had several healthcare leaders, both at the national level and at the regional level, and using this degree as a springboard, I've made good bonds with those individuals, and I suspect those relationships will also be very durable.
Thanks. Just one more question for the two of you, and I'll start with Brian again. You're still fairly new in the program, have a semester, maybe a semester and a half under your belt, but how has what you've learned impacted your work so far?
Well, I'll say there are a number of different things that have changed from the last time I did intensive research. Part of it might be technology based, but part of it might just be UPenn in general and the assets that are available to a student in the University of Pennsylvania just completely blew my mind. The first introduction I had to the online library and the resources that are available made me think, wow, I guess I can just put aside any leisure reading that I'm ever going to do because there's so many things that I would love to dig into and just read, although I don't have a lot of time to do that either because of the program. But what I've found is as we take on each different assignment or a discussion post or reply, with these different topics that we're learning, there's such a vast amount of research we can do to learn basically almost whatever you want to extend onto or to add onto or supplement the topic at hand and really expand the very specific discussion points or assignment that you're given. If you're writing a paper, I found myself several times, and I do not count this in the schoolwork that I was quoting, the 10 to 12 hours, going down rabbit holes that are related to but tangential to, and just learning so much about something I'm interested in. So having said that, it's brought a slightly different, more academic flavor to my work and some of the reports and evaluations. I'm constantly valuing companies and evaluating different opportunities. That has much more of an academic flair to it. So I'm now footnoting some of my reports that my coworkers find amusing.
That's great. Thanks. Tim, how have you seen the program impact your work after almost 2 years in the program now?
Well, this is embarrassing to say, but this is my fourth graduate degree. I was a little worried that I wasn't going to learn as much as I had hoped. I think the reverse has been true. So I think with any new course of study, you gain a new lens and you can look at problems with a new perspective. And I certainly have changed, really transformed the way that I look at many of the business side problems that we face in academics. My understanding of healthcare economics has exploded relative to how I was beginning. The health operations course was just brilliant, so my understanding of what's going on the logistics side and the background is phenomenal now, I feel. Also, I got a lot out of an elective course, which was the health law program taught by Ted Ruger. That opened my eyes to many issues that I really didn't understand, that I had no understanding about. So I would say the way that I approach essentially every problem is categorically different, and I must admit I'm also very disappointed in how little I knew about these problems beforehand. I had no insight into my lack of understanding of some of these just fundamental problems that we face, and I feel like at least I have a pathway of gaining expertise in these dimensions that I didn't have before.
All right, thanks. So, Tim and Brian, thank you so much again for taking the time to do this call. I know for sure that you have lots of work to do, so it's really appreciated. And both of them have also offered kindly to share their email if anybody's interested. So if you'd like to follow up with either of them, please just let us know. My email address is in that chat box, and you can email me after the session. So to start the program this fall in August 2019, the final application deadline is May 1st, and you should get all of your materials in for that May 1st deadline. That includes both the online form and also your letters of recommendation and transcripts as well. If you are having any issues getting those in by the deadline, there might be something outside of your control that happens with the transcripts or with the letter writers, please just email me and let me know, and we can work it out. So to be eligible to apply, you do need to have a bachelor's degree. You should have at least 3 years of professional experience in healthcare or a related field. And then you'll need to apply online. So that involves going to our website, which is improvinghealthcare.net. You can find the online form on the admissions page. The form will ask you to upload a personal statement and a resume, and will ask you to put in contact information for 2 letter writers. Those recommendation writers should be people who have a close professional or academic relationship with you and can speak to your skills and your ability to succeed in the program. And just so you're aware, in the online form, as soon as you put in your recommender's contact information and save it, the system will automatically email your recommenders to ask them to send in a letter. So you might want to talk to them ahead of time and just give them that heads up so they know what that email is when they see it. The only supplemental materials that are sent outside of the online form are your official transcripts from previous schools. Those should be sent directly from the school to us. They can send it either electronically or they can send a hard copy through the mail. Any questions about the application process or anything else we've covered so far? All right, great. So one last thing before we move on to the Q&A, I just wanted to make everyone aware that there are a couple of certificate options. First, on the left side here under the blue column, there is a professional development certificate. If you decide that maybe doing a full-fledged master's degree isn't quite what you're looking for, you might want to look into this professional development certificate. It draws from the same topics as the master's program, but these are not academic credit courses. They're not master's level courses. So they are definitely less rigorous, less time intensive, less expensive. These are $1,500 per course. You can either take courses individually if there's just one or two that you're interested in, or you can take 4 within a year to earn that professional development certificate. So again, the professional development certificate, those are non-credit courses. So they cannot be transferred into the master's program. There's no official transcript involved with those. And it's a certificate of completion if you choose to do 4 of those courses. On the other hand, if you are considering doing the master's program and you're not sure and maybe you want to try out a course and see how it goes, you can take one master's course as a non-degree student to try it out. And that's open to everybody, whether they're in Penn or outside of Penn. Finally, for Penn people only, so for Penn employees or students who are already in Penn graduate programs, there is an academic credit certificate. It draws from the master's curriculum, and you would take 4 courses to complete that certificate. Those are credit-bearing master's level courses, so if you take that certificate, it can be transferred into the master's program. So if anybody's interested in one of these sort of alternate tracks or options, I'm happy to talk to you about them and answer any questions you have about it. Feel free to email me and let me know after the session. And that's all we have for the presentation today. Again, that final application deadline is May 1st. You can find the application at improvinghealthcare.net. And my contact information is up here if you'd like to contact me with any further questions. And with that, this is your time to go ahead and ask questions. You can type it up in the chat box, or if you have a microphone, feel free to speak up, and I can answer questions for the next 15 minutes or so.
I came across this program looking for a master's in public health, and I guess what I'm trying to figure out is the biggest difference between this degree, because I read through all the materials and I really like the curriculum and the plan and the classes, but I guess I'm still a little bit torn about which direction I should go, if this is the program or if I'm still really interested in a public health degree.
Yeah, good question. So there probably is some overlap with this and an MPH as far as like policy content. Some things that an MPH would focus on that this program doesn't are epidemiology, environmental and occupational health, maybe statistics. So if those types of things are what you want to come out of the program with, then it might be an MPH over this program. This program is really more about getting the practical skills to implement innovation. So how do you identify areas in need of innovation, and how do you actually operationalize those ideas? How do you evaluate them to see if your idea, if your new program or policy is actually working? And I will say this degree is also not a research degree, it's a practical degree. So, if you're planning to, eventually end up in a PhD for public health, for example, then maybe an MPH is more research oriented and might be the right path.
Hi, Catherine. We have a couple of questions from the non-chat track. One is, how long does it typically take for somebody to complete an application?
Usually about 4 weeks, I would say. The online form part can go pretty quickly, but it can take some time to get those official transcripts sent out once you request them. It's always good to give your letter writers a little bit of time to be able to write the letters and send them in. So I would try to give yourself a few weeks if you can.
And who would be a good person to ask to write a recommendation?
Current supervisors are always great, or a current colleague if that's not an option. If you are in an academic setting or maybe have done a degree fairly recently, if you had a mentor in that world, that would be a good choice as well.
I'd also like to make everybody aware that our two guests, Brian and Tim, are still on the line. So if you have questions for them, that would be something that they would probably be open to.
And I know in our sign-up form, it looks like we had several international attendees on. So I just want to reiterate that yes, international applicants can apply. Since this is an online program, students would not be eligible for a J1 student visa, but they would need to get a B1 business visa in order to attend that on-campus session. But certainly international applicants are welcome.
We have another question from the non-chat track. For Brian, as a non-clinician, do you feel that the course material is relevant and understandable?
Surprisingly so. Being in healthcare for quite a while, I feel like I know a lot of things in the healthcare industry has some idiosyncrasies or unique characteristics that someone coming in from the outside with a healthy dose of common sense might not quite understand. Having said that, it is my personal opinion that you do not need medical training in particular to participate at all. I think one of the values of the program is having a mix in the cohorts and having the constant interaction. I'm not sure if this is technically correct, but I think in my group it's probably about 50-50 between providers and those that aren't actively involved in providing healthcare, nurses, physicians, surgeons, so that it's one of the most valuable things is having those different perspectives. And some of the things I just take for granted, I realize may not be something someone else may have thought about, just like Tim mentioned a few minutes ago. And it goes exactly both ways. Some of the things I would think, well, this would be easy to do. When I say that, I then have a surgeon or a pediatrician in one case explain to me why that what I thought was simple makes absolutely no sense. So some of the greatest learning I've had to do with the interaction of the different worlds there. So the answer to the question is no, you definitely do not need formal medical training.
Thank you.
Yeah.
Question.
Sorry, I just wanted to add on to that. Yeah, Brian, you're right. It's roughly half and half clinicians and non-clinicians. And the program definitely is looking for a variety of backgrounds because of that type of learning that Brian talked about. The sharing of experiences and perspectives really helps everybody, each student, contextualize their role. So we are looking for that variety.
So, Catherine, this is a question from the chat track for you. How similar is this degree to an MHA?
An MHA, so a Master of Health Administration, probably would include more financial and management-specific courses. Everybody in an MHA would either be already in administration or going into administration. So I think this degree, the MHCI, would probably be more interdisciplinary, and there would be a lot more perspectives in the cohort.
Another question from the chat track. Will the current and past cohort attend the seminar in the fall?
So all the current students always attend the seminar, so that includes the cohort that started the year previously and the new cohort that's starting in the current year. And then we also invite alumni back to come for a portion of the seminar.
All right, another question from the non-chat track. This one is for Tim. Can you please talk a little bit more about the networking that's developed within your cohort?
I can do. So several of the people have various backgrounds. So one of them in particular is an ER physician up in New England. So he had faced some similar challenges with his network negotiating with insurers, and he built a whole program around these negotiations and how to be successful with them. We've developed a close relationship, and in fact, his chair and I got to know each other through a recent conference meeting. So that network is metastasizing in some respects. Another good example is one of the other individuals that we got to know who changed jobs during her experience in the Masters. She now is a consultant for a firm in Chicago, and I kept up with her because she is now tasked with her consultant company to go into hospitals and create new solutions for some of the challenges that they face. And just seeing the business side that she has to contend with has educated me tremendously. Some of the other people that we have, let me think about this for a moment. As Brian mentioned, we have people with strong business backgrounds. Their style of thinking is so much different from mine. I find that I learn something every time I talk with these individuals. So these are some of the types of people that you would encounter on a regular basis. And I think, as Brian mentioned, the number of individuals or the depth of individuals is much broader now in the second cohort. I think as the popularity of the program continues to expand, you'll have a deeper and deeper bench of individuals with widely diverse backgrounds.
Thank you. We have a question from the chat for Catherine.
Mhm.
Does this degree have any accreditation with CAHME?
Not with CAHME. The program is accredited under the University of Pennsylvania's accreditation by the Middle States Commission on Higher Education.
Another question from the chat. I just joined at 4:45. Did you or could you share any of the current roles of graduates the graduates of this program have?
So our very first cohort is graduating this spring. So I don't have data on alumni yet, but I can share. There was a slide that summarized some of the backgrounds that our current students have. So they're roughly half and half clinicians and non-clinicians. So on the clinician side, there are physicians and nurses in all sorts of settings, hospitals, academic medical centers, private practice. On the non-clinician side, we have executives, managers, administrators, consultants, researchers in all different types of health organizations. I can share so far that 2 current students have gotten new roles while they're in the program. Again, we don't have any graduates yet. That'll happen for the first time this spring. But 2 of our current students have gotten new roles. They both just happen to be clinicians. So one of them is a family physician who has a new role as director of transformation in her practice group. And the other student is a nurse who got a new role. It was actually a newly created role as a patient care navigator for bundled payments. So she works with a lot with patient engagement and advocacy in her hospital.
We have one more question in the chat.
Sure.
That question is, quote, I am a human-centered designer, for example, a user experience designer or user experience researcher. Have any individuals with this specialty come into the program before? I very much want to be involved in healthcare innovation.
We haven't had anybody with that particular kind of background yet. I think it sounds like there could be applications of that sort of experience to the healthcare innovation world. So yeah, I think it would make sense to apply and it could fit. I would just recommend in the application, just make sure you're really clearly demonstrating and making a strong case for how that sort of experience connects to healthcare, and be as specific as you can about what you would want to do in healthcare.
And I have one more from the non-chat track, which is, how is this program different from an MBA?
Sure. So Tim had talked about this a little bit. He mentioned that he was looking at MBAs when he found this program. An MBA, I believe, would be more broad. This program is definitely more focused in the healthcare sphere. And this program also, again, is really about operationalizing innovation methodologies. How do you bring those ideas from idea to implementation? An MBA would also probably be more management and financial focused than this degree.
Catherine, I don't know if it makes sense, but I might be able to help a little bit because I do have an MBA.
Yeah, please, if there's anything to add.
So the simple way, which is just my view, that I would describe the difference is, and it depends on the MBA program you're going to go through, because some of them may be very similar in the respect that I'm going to comment on. But in many ways, an MBA is a program that has been developed and continues to be taught in a very similar way to what it may have been 30 years ago, in which case you'd have a textbook and you'd go through the textbook. To the extent you have case studies and other real-time, real-life examples and interaction, it could be equal. But what I've found in the healthcare innovation program is, it's almost the difference between reading a textbook and a book that you'd want to pick up just because you'd enjoy reading it. I can't imagine myself ever picking up the textbooks that I had for my MBA classes, although there were some very good ones. In this situation, all of the materials that I'm reading are directly relevant to things that I'm interested in, want to learn about, and will apply today above and beyond that. So that's the best way I would describe it. It's from my perspective, it's building upon that foundation, so it's taking it to the next level. But something like behavioral economics is relatively new, and the things I'm most interested about it are all the things that we discussed and learned, and the things that I'm learning in healthcare operations, very much the same thing. And the biggest part of that has to do with the instructors and the professors that are leading these classes and teaching the classes. For example, the healthcare operations professor is the very same guy that teaches McKinsey consultants for operations management, and that's about as good of a process as you're going to get. So part of it is the specific nature of the text you'll be reading, as well as the professors individually, just the high level of professor that you'll be exposed to.
I may just add, there are a number of people, I think, in both cohorts who came into the program with MBAs just like Brian. I think Gary Bubley and I want to say Ray also had MBAs coming into the program.
Yep. All right, so we are at 5 o'clock, so I just want to thank everybody who signed on to the call today. Thanks again to Tim and Brian for taking the time to talk to us. We will be sending out a recording of this presentation to everybody who signed up, so if you joined late, or if you know somebody who signed up and wasn't able to join, you'll all get sent a recording. Have a good night, and if anybody has additional questions, I'm going to hang out here just for a few more minutes for any last minute questions, or please feel free to call me or email me afterwards.